Hi everybody, this is Dr. Matt from Williams Chiropractic. This is episode number 2 where we're going to be talking about posterior ankle impingement syndrome. This is very common after someone has an ankle sprain. It can kind of happen in congruency with that. Typically how this happens is you have a hyperplantar flexion movement at the ankle, and then you can get impingement in the back of the ankle. Posterior ankle impingement syndrome is typically seen in such activities as ballet dancers, soccer players, football players, anyone or anything that you can easily sprain your ankle or have a fracture. This is kind of a confluence of other things that happen. It can happen in isolation, but it is more common for it to happen with something else going on. How this pain or the syndrome is elicited is when you go into a hyperplantar flex position, the talus impinges on the soft tissues or potentially on bony structures in that area. Another thing that can happen is you can have something called an os trigonum, which is a small ossicle just anterior to the Achilles. And again, when those tissues approximate, that can also cause posterior ankle impingement syndrome. Alright, so first thing that we want to do is we want to observe the area. So notice any swelling in this. This is an asymptomatic patient, so there is no swelling, anything. Another differential that you need to rule out with posterior impingement is Achilles tendinopathy, rupture, also retrocalcaneal bursitis, and we also need to look and potentially get radiographs if we suspect an os trigonum or if there is a large spur coming off the posterior talus. So these are all some things you need to look at. Now, a great clinical test for this to discern if there is some impingement happening is all you do is you're plantar flexing, just like so. If you need to add a little bit more force like this, you can go just like that, and the person will get pain deep to this structure right in here, deep to the Achilles. And if you palpate on either side deep to the Achilles, you can also recreate their pain. The pain should not be on the Achilles itself. Another test you can do to discern which tissues are actually experiencing pain, I'll get you to push your foot into me as hard as you can, and you can palpate the Achilles, and they can tell you if that's their pain or not, or if it's deep to that. So if their pain is deep in here, they may have a retrocalcaneal bursitis or that posterior impingement syndrome that we talked about. Thank you.
So typically where we're starting these clients is just an isometric hold to get activation of the muscles around the ankle. Typically a goal for me and my clients is to get them to a minute isometric hold for 3 in a row. So it's pretty basic. You get them standing on a ledge. You can also do this with both feet. So we're set up here and the band is providing a posterior glide to the talus. This is typically given to our clients with more anterior impingement, but can be beneficial to those with posterior impingement as well, because you're getting into that stretching of the posterior capsule. So essentially we get a nice force there, and then we're going to come into a little bit of dorsiflexion as far as the client can tolerate. And typically I get them in there at their end range and kind of wiggle around or scour the joint. And I get them to hold it for maybe 10 seconds at that end range, repeat it for 10 reps in a row. Same setup, but if we're trying to facilitate increased plantar flexion, we can do the same glide and just come into that end range plantar flexion where our clients are symptomatic. So similar setup as before, however now the band is providing that anterior glide to the talus, and we can do both movements. So we can get the client going into dorsiflexion towards that end range, and same idea, scour the joint at the end range where they're symptomatic. Ideally the glide takes their pain away. We can do the same kind of setup for the anterior glide on the talus to facilitate plantar flexion.
I got you with that.
So we can also do this with our hands if we don't have the equipment available at home. Typically people will, posterior heel impingement will tolerate an anterior glide going into plantar flexion. So we can get them towards their end range, apply that anterior glide to the talus, and then really go in and scour that end range